I've never seen so much energy and enthusiasm, and everybody wants to learn.
It takes a lot of work. It takes a willingness of the players involved to adapt to change.
It's almost like a marriage because you can just anticipate what they're going to say based on the situation at hand.
You need a team, a well-trained, well-processed team that can take care of the patient in a very fast and furious pace.
If you have the right team and the right technology, you can offer a huge service to the community and more importantly to the patients.
Stroke has changed. Stroke is now an emergency because we can do so much for stroke.
We live for these moments where people need our services of the greatest urgency, and that's when we're at our best.
Stroke afflicts around 750,000 individuals annually in the United States. It's the #1 leading cause of disability in the United States and the 3rd leading cause of death. Because of the disability component, there's a high cost to the healthcare system, upwards of $50 billion.
And stroke is happening, it's like the brain is on fire. You just have to put that out as fast as you can. This is a very precious commodity, brain. You can't replace it. You cannot grow it.
Time is brain. The longer you delay intervention, the greater the possibility for long-term permanent disability.
We have an integrated care pathway, and it really starts at the emergency room level.
They may have something as subtle as I just feel some numbness around my face. Well, that may not sound like a lot, but it could be the precursor of a much more serious event. Within about 5 minutes, we've done a good neuro assessment on the patient. Our nurses have established an IV, and we get them over to the CT department for a CT scan of the head.
Neuroradiologists are able to provide to us a 24/7 neuroradiology team, which is almost unheard of nowadays.
Our intensive care unit nurses are some of the best I've ever worked with. They know these patients, they know the changes, they know the subtleties, and when they call you, you react because they're on to what's going on 100% of the time.
We have built a biplane room, which is a room that allows us to navigate through 3-dimensional technology through the vessels of the brain and able to get clot out or treat an aneurysm.
We can go in with catheters and coils and wires and get into the blood vessels and open them up. We also have the capability to go into aneurysms and arteriovenous malformation. These are weak blood vessels that can bust open and bleed.
You can have a patient that is completely paralyzed on one side and their face is completely paralyzed, they cannot speak, and then 2 minutes later they can sit up in the bed and talk to you and move everything. And we can do it all here at Kennesaw.
Right now, there are very few centers in the area that provide this kind of care.
We probably have about 10% who walk away without any disabilities whatsoever. A third of patients typically need some type of rehab, whether it be home physical therapy or inpatient rehabilitation, and probably a good 60 to 65% have some permanent disability as a result of their stroke.
Rehab is what brings them back into being able to function, even just basic self-care. And that includes physical therapy, occupational therapy, speech therapy, and all those various disciplines in rehab. We are hoping to reintegrate them not only into the family, but back into the community.
We are really on the frontier of this type of specialty because the technology is improving so significantly and so quickly. We're really just at the beginning of this and learning. It's a very exciting time.
I live in this community, my kids live in this community, and care immensely about my patients and my clinicians, and love what I do too, and I love the challenges of this and how it keeps advancing.
That's the best thing ever when a patient says, "Thank you for not leaving me like that."
It's an amazing procedure that we can bring to our community at this time.
I think we rock. Personal opinion, I think we're doing an awesome job.
This is one of the best teams I've ever worked with. This community deserves this and needs this. It's growing exponentially.
The next plan is to move into the comprehensive stroke center designation, and that's the highest designation that Joint Commission has for a stroke program.
We had a vision. We're working to accomplish that vision.